Module 10. Preparation and Knowledge for Emergencies. Objective. The goal is to equip caregivers with the skills to handle emergencies, understand individual client emergency plans, know evacuation routes, and manage advanced directives and POLST forms to respect clients' medical wishes during emergencies. Lesson 1. Comprehensive Emergency Planning. Lesson 2. Understanding Client-Specific Emergency Plan. Lesson 3. Familiarizing with Emergency Evacuation Routes. Lesson 4. Managing Advanced Directive and POLST forms in Emergencies. Lesson 1. Comprehensive Emergency Planning. Objective. To equip caregivers with the knowledge and skills needed to plan and prepare for various types of emergencies, ensuring they know the steps to take and can act swiftly and effectively when required. In caregiving environments, being prepared for emergencies is crucial. Caregivers must have the knowledge and skills to respond confidently and efficiently to unexpected situations, whether it's a medical crisis, natural disaster, or sudden health deterioration of a client. Proper planning and preparation enable caregivers to act quickly, minimize harm, and ensure continued care for clients. As a LTC, long-term care worker, you may be the sole responder in an emergency, so it's essential to always be ready to handle such situations. Emergency preparedness. An emergency plan is a critical component of being prepared in any caregiving environment. As caregivers, it's essential to know exactly what steps to take in various emergency scenarios to ensure the safety and well-being of your clients. Your emergency plan should include the following key elements. Emergency contact information. Always have easy access to important contact details, including your supervisor, medical professionals, emergency services, and your client's family members. In an emergency, you need to be able to quickly reach the right people for guidance or decisions. Emergency preparedness. Evacuation procedures. If you're working in a facility that could be affected by disasters like fires or earthquakes, it's crucial to know the evacuation plan. Be familiar with evacuation routes and emergency exits. Ensure that you can safely evacuate clients, especially those with mobility challenges, without causing panic or injury. Regularly practice evacuation procedures to stay prepared. Emergency preparedness. Medical response protocols. In the event of a medical emergency, understanding your client's medical history is key. This includes knowing any allergies, medications, and emergency procedures that may apply. Familiarize yourself with basic first aid and CPR, as these can be life-saving. Additionally, you should be aware of specific procedures for more serious emergencies, such as seizures, strokes, or heart attacks, and know when to seek advanced medical help. Emergency preparedness. Communication procedures. During emergencies, especially large-scale events like natural disasters. Communication systems may be disrupted. It's important to have a backup communication plan, such as a landline, walkie-talkies, or satellite phones, to stay in contact with emergency services and other key personnel. This ensures that you can always stay connected, even when typical communication methods fail. Regular training and drills. Your employer will have specific policies and procedures that you must follow in emergency or disaster situations. Once an emergency plan is in place, it's essential to undergo regular training and drills to ensure you feel confident and prepared. Training should cover any client-specific emergency protocols you need to know. Regular training and drills. You should regularly practice tasks like evacuating clients, responding to medical emergencies, and using emergency equipment such as fire extinguishers. Practicing these actions in a low-pressure environment builds muscle memory, ensuring that in a real emergency, you can respond quickly and calmly, reducing panic and improving client outcomes. Fire emergencies. In AFHs, adult family homes, and ALFs, assisted living facilities, periodic fire drills are essential for practicing emergency procedures and saving lives. HCA workers should be familiar with the client's evacuation plan, the best evacuation routes, and the address and cross street of the client's home, which can be found in the client's care plan. Fire emergencies. If you discover a fire, remember the RACE acronym to respond safely. R equals rescue. Immediately stop what you're doing and move clients to safety. A equals alarm. Sound the alarm by pulling a fire alarm or calling 911. C equals confine. Close all doors and windows you can safely reach to contain the fire. E equals extinguish. Use a fire extinguisher if the fire is small and manageable. If the fire is too large, evacuate the area instead. By following RACE, you ensure a safe and effective response during a fire emergency. Actions to take if fire prevents evacuation. If fire prevents you from evacuating, stay with the client and take immediate steps to protect both of you. First, call 911 and inform them that you are trapped. Find a room with the door closed to slow the spread of the fire, and seal any gaps around the door and vents with clothing or towels to prevent smoke from entering. Since heat and smoke rise, it's important to stay low to the floor, where the air is clearer and safer. These actions will help reduce the risks of smoke inhalation and give you the best chance of staying safe until help arrives. Never put water on a grease or liquid fire, as it will cause the fire to spread. Put water on an electrical fire, as it can lead to a serious shock. Re-enter a burning building to save pets or valuables. Try to move a burning object out of the room. Use an elevator during a fire escape. How to use fire extinguisher. A fire extinguisher is required in all AFHs and ALFs. A fire extinguisher labeled ABC is suitable for all types of fires: wood, paper, oil, grease, and electrical. To use a fire extinguisher, remember PASS. P equals pull. Pull the pin and snap the plastic seal. A equals aim. Stand back. Aim at the base of the fire. S equals squeeze. Squeeze the handles to discharge the extinguisher. S equals sweep. Sweep the nozzle side to side. After the fire is out, ensure it stays out. Evacuate everyone from the area, and ventilate the space. Document and report any fire incident for safety and follow-up. Creating a safe environment. Effective emergency planning goes hand in hand with creating a safe environment that minimizes the likelihood of emergencies occurring in the first place. As caregivers, it's essential to regularly assess the caregiving space for potential hazards. This includes checking for loose rugs that could cause trips, poorly lit hallways that increase the risk of accidents, and ensuring that medical supplies are adequate and accessible. Creating a safe environment. Regular environmental safety checks should become part of your routine tasks, including verifying that essential equipment such as medical devices, fire alarms, and safety systems are functioning properly. By identifying potential risks ahead of time and addressing them proactively, you can reduce the chance of emergencies and create a safer environment for both yourself and your clients. Lesson 2. Understanding client-specific emergency plan. Objective: to help you understand the unique emergency plans for each client, including any special needs or considerations, so you can respond quickly and effectively during emergencies, ensuring their safety and well-being. As a caregiver, it's essential to recognize that each client you care for may have unique needs, and their emergency plans must be tailored to these needs. In an emergency, knowing how to act quickly and appropriately can make a world of difference to the safety and well-being of your client. Know the client's health conditions. As a caregiver, it's crucial to understand each client's unique health needs to respond effectively in emergencies. This knowledge ensures you can provide the appropriate care, maintaining their safety and well-being during critical situations. For example, clients with diabetes may require specific protocols for managing their blood sugar levels, especially during stressful situations. Similarly, clients with respiratory conditions such as asthma or COPD may rely on inhalers or oxygen, and knowing how to properly use these tools in an emergency is crucial. Consider cognitive and emotional needs. Clients with cognitive impairments, such as dementia, or emotional needs, may require additional support during emergencies. For example, clients with dementia may struggle to understand emergency procedures, so it's important to provide extra reassurance and clear, simple instructions to help them stay calm and follow your lead. Similarly, clients with anxiety or fear may need calming techniques, such as soft reassurances or guided breathing exercises, to manage stress and remain composed. Assistive devices and equipment. As a caregiver, it's crucial to understand how to operate any medical devices or assistive equipment that your client relies on, especially during an emergency. For instance, if a client uses a ventilator, you may need to assist them manually if there's a power failure. Similarly, for clients who use mobility devices like wheelchairs or walkers, knowing how to safely assist them with movement, particularly during an evacuation, is essential. Respecting personal preferences. It's important to consider your client's personal preferences and needs when creating their emergency plan. This may include dietary restrictions, such as specific foods they need during an emergency evacuation, or cultural and religious beliefs that may affect how they should be treated or assisted. For example, some clients may require special accommodations related to food or specific rituals that need to be followed in times of crisis. Update the plan regularly. As your client's needs evolve, it's essential to regularly review and update their emergency plans. For instance, if a client's medical condition changes or they begin using new equipment, the plan should be adjusted accordingly. Keep open communication with your care team and the client's family to ensure everyone is aware of the updates and knows what to do in case of an emergency. Lesson 3. Familiarizing with emergency evacuation routes. Objective: to ensure caregivers are familiar with the emergency evacuation routes in all the facilities they work in, so they can guide clients safely and confidently during an evacuation, ensuring a quick and organized response in an emergency. As a caregiver, it's essential to be familiar with the evacuation plan for each client in case of an emergency. This includes understanding each client's unique evacuation needs based on their physical and mental abilities. You should know the safest and quickest evacuation routes in the facility, along with the primary and secondary safe areas where clients can be taken for safety during a crisis. Being well prepared ensures a smooth and efficient evacuation, protecting both you and your clients. Understanding the layout and routes. As a caregiver, it's essential to be prepared for emergency evacuations, especially since you're often the first responder in a crisis. Start by studying the facility's floor plans to familiarize yourself with all exits, stairwells, elevators, if applicable, and safe zones. Knowing multiple evacuation routes ensures you can adapt to changing circumstances, such as a fire or power outage. This includes understanding each client's unique evacuation needs, based on their physical and mental abilities. Understanding the layout and routes. For clients with mobility challenges, be aware of accessible routes and any specialized equipment like evacuation chairs. Also, understand specific procedures for various emergencies, such as fires, natural disasters, or medical crises, especially when caring for clients who rely on life support equipment or have high-risk medical conditions. Being prepared ensures a safe and efficient response during emergencies. Communication and timing. Effective communication during an evacuation is crucial for ensuring a smooth and organized response. Familiarize yourself with the communication tools available, such as the emergency alert system, walkie-talkies, or internal messaging apps, to stay connected with team members and coordinate the evacuation. Additionally, prioritize clients' needs by identifying those who require extra assistance, such as individuals with mobility or medical challenges. This ensures that you can provide the necessary support and ensure that all clients are safely evacuated within the required time frame. Clear communication and prioritization are key to managing the evacuation efficiently. Lesson 4. Managing Advanced Directive and POLST Forms in Emergencies. Objective: to equip learners with the knowledge and skills to recognize, manage, and implement advanced directives, and the POLST form physician orders for life-sustaining treatment in emergencies. This ensures that clients' wishes regarding life-sustaining treatments, resuscitation, and other medical decisions are respected, especially when they are unable to communicate their preferences themselves. As a caregiver, your role in an emergency extends beyond providing physical care. You also need to ensure that your clients' medical wishes are respected, especially when they are unable to make decisions for themselves. Advanced directives and POLST forms are essential tools that guide your actions and ensure that the client's preferences regarding resuscitation, life support, and other medical treatments are followed in times of crisis. Understanding advanced directives. An advanced directive is a legal document in which a client specifies their healthcare wishes, in case they are unable to communicate during an emergency. These documents typically address decisions related to life-sustaining treatments, resuscitation, organ donation, and more. It's crucial to understand a client's healthcare wishes before an emergency occurs. Advanced directives should be stored in an easily accessible location, such as the client's care file or with family members, so they can be quickly retrieved when needed. Understanding advanced directives. In an emergency, the first step is to locate the advanced directive and present it to emergency responders. This ensures that medical personnel can provide care that aligns with the client's preferences. By knowing the content of the advanced directive, you can make sure the client receives the care they want, whether that's aggressive interventions or comfort care, even if they cannot communicate in the moment. Understanding the POLST form. The POLST form, physician orders for life-sustaining treatment, is a medical document used primarily for clients with serious, advanced illness. It provides specific instructions for medical interventions, including whether or not to perform CPR, use life support, or initiate other critical treatments such as intubation. The POLST form is a legally binding document signed by both the client, or their surrogate, and a physician, ensuring that healthcare providers, including emergency responders, must follow its instructions. The form is often printed on bright green paper, in states like Washington to make it easy to identify. Photocopies and faxes are also legally valid. The POLST form outlines critical decisions about resuscitation, life support, and medical interventions. It includes choices such as full code, all life-sustaining treatments, do not resuscitate, DNR or do not intubate, DNI, comfort measures only, focusing on pain management and comfort, not curative treatments. Calling 911 during an emergency. When an emergency occurs, it's your responsibility as a caregiver to provide essential information quickly and accurately to emergency responders. Steps to follow when calling 911. Describe the emergency. Be as specific as possible. For example, my client Mr. Lawrence has collapsed and is not breathing. He has advanced heart disease and a POLST form that indicates do not resuscitate. Provide critical information. Your phone number, the address and nearest major cross street. Ensure you can provide clear directions if needed. Client's location in the facility. Steps to follow when calling 911. Stay calm. The 911 operator may ask additional questions, such as the client's condition, medical history, and any interventions that may have been attempted, such as CPR. Stay as calm as possible, and provide these details clearly. Keep emergency information accessible. It's helpful to have this information written down and placed near the phone. This ensures that even in a stressful situation, you can quickly relay accurate details. Congratulations! You finished Module 10. Please complete the quizzes. Congratulations! You finished Module 10.